Objective is to come to Sri Lanka and learn about your healthcare system, be able to compare to Australia as well, and just look how different or how you guys manage your healthcare and how efficient you are at it, which we have picked up that you're great at doing what you do.
So far I've had a great time at IIHS. I can't get over the amount of enthusiasm and the warmth of the students that have all welcomed us with open arms. All the staff, everything has just been amazing so far. I've been given this amazing opportunity to come over by IIHS, and I don't think I could have done it with any other university, so thanks.
With my experience in Sri Lanka over the last 2 weeks, I believe that the healthcare system in Sri Lanka, whilst you might not have as many systems and computerisation and high-tech machinery that we would have at home, I believe that the Sri Lankan staff, the doctors, the nurses and all of the admin staff do a very, very good job at using the equipment that you do have to the best of your ability and provide a very, very efficient system for the patients of Sri Lanka. I'm also blown away by how much all of the directors and all of the people we did get to meet in all of the healthcare systems want to improve the systems in Sri Lanka. At home, you know, we're also striving for improvement to get the best services that we can for the people of our country, and I can see that you also do the exact same here, and I find that great. The people are amazing, the food's amazing, and I've had a great time.
I decided to study at UNE because I'm interested in rural health, and UNE is one of the few universities where I can study a Bachelor of Pharmacy in a rural setting. Life at UNE over the last 4 years has been a great experience. I particularly enjoy the small class sizes and the amount of support we get from the academic staff.
I selected Sri Lanka for my study tour visit because I really wanted to experience something different, have a look at a different culture, experience the healthcare system that I'd never seen or heard of much of before. I'm from a rural town in Australia, so I wanted something that was completely out of my comfort zone and just to experience something just a little bit different.
Sri Lanka is doing very well with what they have. You have limited resources. You're doing absolutely amazing in the system. What would really improve the healthcare system is to move away from paper, to give people an opportunity to verify drug names, not have to fight their way through someone's handwriting, to optimize the time that people have to spend with a doctor, to spend with a pharmacist, to learn about what they're going to do. Too often, if there's too much focus on I need to do this next and do this next and do this next, move this paper, go here, we lose track that we're dealing with people. And it's all about the people. It's not about get the medication out, sign this prescription, do this. It's does this person really understand? And if you could bring in that little bit of computerization, that little bit of automation, doesn't have to be big, but just that little bit of extra time to remember that that is a person in pain, that is a mother who's worried about her baby, not just here's a prescription, could I have the next person?
I think for our biomedical science students, some of the really important things that they've learnt on this visit are just a little bit more about how a clinical lab and a microbiology lab, how these things actually operate within a hospital. It's something that we teach them as undergraduate students, but throughout our degree at UNE, they don't get a lot of experience practically going out into a clinic or to a hospital to see these things in action. So actually being able to set foot in a hospital and talk to some of the doctors that are working there has given them a much better understanding of how the skills that they are learning in our classes and in our labs at home, how that actually applies in a real life situation. So I think that's one really important thing that our students have come away with. I think some of the other really important skills that they've been practicing and learning while they're here are some of their communication skills. We're trying to teach our students that communication is a really important part of science and being able to come and talk to new people, hold a conversation with people that they've just met, communicate some of their ideas. So coming on this trip and having to talk to a wide range of people and to people that they've just met, and even for some of our students to stand up and give some presentations, has been really fantastic experience for them in honing some of those communication skills as well.
My experience in Sri Lanka was one of a kind, definitely. The environment was different from Australia and very warm, but we enjoyed it because we're from a cold place. The animals were extraordinary because we don't see elephants in Australia ever, and we saw them walking down our street outside our hotel. The people are amazing and extremely friendly, and I hate to say it, but much kinder than Australians. And the culture is definitely amazing. The food is a bit spicy for me, but it was very enjoyable.